Great news. Dirty Keto is now on Amazon. If you're living in the U.S., go straight to Amazon and get Dirty Keto. Watch it, rate it, and review it. If you're outside of the U.S., meaning Western Europe or Canada or Mexico, it's not there yet. Don't ask me why. Listen, those people made me put a PG-13 rating on it when there was nothing in it that would have caused that. But let's get ahead of this thing. Let's watch it, rate it, and review it. Go get Dirty Keto right now, and on with the show.
Thanks for listening to Vinny Tortorich on NSNG Lifestyle Audio. Welcome to Fitness Confidential One-on-One. Vinny Tortorich, founder of NSNG, goes long form with top luminaries in the field of health and fitness.
I am Vinny Tortorich, folks. Your good intentions have been stolen, but don't worry. I'm here to help you get them back. You may be soft and succulent at the beginning of this process, but hang in there. Before long, you will be lean and mean, guaranteed. Just like my guest, that's right, it's the Friday show. So there's no Anna Vocino today. There's no Gina Grad. But we have a guy with a lot of knowledge, and a lot of knowledge about pain. And I'm a guy with a lot of pain. So we're going to learn something today, folks, without any further ado. Please welcome anesthesiologist and sports medicine fellow, Johnathan Edwards. Yeah.
Oh,
geez. I love you already, Johnathan. You can tell.
Yeah.
So thank you for being on today. I can't thank you enough. And
likewise.
You have a lot of studying under your belt, and you've done a lot of things. I'm going to tell you. I'm going to come right in. I'm going to tell you why I wanted to. The one thing that got me into wanting to have you on this show. We can start here, and then we can go backwards from there.
Sure.
The mention of ketamine. When in the 1980s and 90s, I had a gay friend who was into all the drugs.
Okay.
He was into cocaine. He was into, God, what's the one that makes you feel love? Ecstasy. Yeah. E, as they were calling it. Mm-hmm. And he came home like he was really strung out one time, and the next day he told me, he goes, "Oh man, last night I did Special K."
Yeah.
And I was like, "Special K?" He goes, "Yeah, Special K. They call it Special K." I said, "So you ate some cereal?" I mean, literally, I'm so square. I'm as square as a pool table and twice as green, right? And he was like, "Oh no, this is ketamine." And I've been around horses my whole life. And I said, right. Wait a minute. You're taking veterinarian drugs? And Johnathan, stop me if I'm wrong. You may know this, you may not. He goes, well, what you do? I'm remembering this from like 1989, maybe 1990. He goes, what you do is you cook it down.
With a microwave. Yeah.
Was it with a mic? I didn't know that. I just figured they put it in the oven.
Put it in a microwave and cook it down. Yep.
You cook it down and it becomes like crystals.
Yep.
And he goes, and we take those crystals and we scrape. You know, everyone that's on drugs should be running the country because they figure out shit that nobody else can figure out.
Oh, they're innovative. Yeah,
right.
I had no idea, and it's somebody who had done Special K explained the process to me, and I hadn't read it anywhere else. Yeah.
Yeah. And this way, he goes, we crystallize it, and then we take something and we scrape it into a powder, like we just scrape it off into a powder, and then we just put it up our nose.
Yep.
And I was like, and you think that's okay? You're willing to do that? You're willing to go bungee jumping and not checking to see if the bungee is on correctly or anything? You just, hey, they must have put it on right. If I was going to jump off of a bridge with rubber bands hooked to me, I would check it 10 times personally myself and then decide not to do it because that seems like Crazy, right? But they're jumping off of a bridge.
Oh, yeah.
So that's what I knew about ketamine. Now, this is where you come in, Johnathan. This is why I have you on the show today. Cut to 2 months ago. I'm talking to a buddy of mine about my age. He's got a kid, wonderful family, lovely kid. Kid's not on drugs or anything else, but the kid has some issues, right?
Sure.
As a lot of kids do today. And they decide, hey, there's ketamine. They can give this kid ketamine in low doses, like the word I learned, the new term, microdosing ketamine, and it could break his depression or whatever it is. I don't want to get too deep into it because I know my buddy listens to the show, and I'm hoping he hears this show. As a matter of fact, I'm going to call him and tell him to listen to it.
Yeah.
Where are we with 1989 gay guys doing this in New Orleans, scraping it out of a microwave, and my buddy's kid getting microdoses, and how do they deliver this microdose?
Yep. So just right up front, ketamine on the street, which is what your friend in 89 was doing, and ketamine in a clinic are two different animals, completely different. They're the same substance given completely different. One obviously is snorted up the nose. You make it, in your kitchen or whatever, or get it from some dealer. Where pharmaceutical grade, like I use in the operating room, and you kind of got to go back quickly through the history of ketamine. It actually was a buddy drug in Vietnam, and it got fast tracked through the FDA because it was the ultimate anesthetic. It was originally found you can give a dose of it in the muscle, and you could block somebody's pain, disassociate them from their fracture or if they got shot or whatever, and you could get them back to safety without the need of oxygen. Where if you give somebody, say, morphine, they're going to probably need oxygen or their respiratory rates. Ketamine doesn't affect your respiratory rate like that. And it also supports blood pressure in a little bit. So ketamine for the longest time was the anesthetic of choice for kids, actually. It was huge in pediatric anesthesia. And it was huge. And then it became, before the other anesthetics came out like propofol, it was one of the go-to operating room drugs. So it's been in use since the 60s, really. And they knew even back then it was good for depression, but but because of the whole psychedelic, the Nixon administration, and before that even kind of put the clamp down on studying any psychedelics and things like that, it really didn't resurface until almost the 2000s. And there's a lot in between there, and it's in the book I wrote, but the revolutionary ketamine. But they found out it first helped with eating disorders, some group in the UK, and they showed, remember when bulimia was the big thing back then, and
that was probably
anorexia.
The first time I started hearing about bulimia was early 1990s, say 92, 93. Yeah.
So they stopped. They were able to show in a group of adolescents who had extreme bulimia, they were able to abate or, in a sense, treat this mental disorder. And then they also saw that their depressions got better. But not only that, they saw hints of like suicidality decreased. And that's what got a lot of researchers' attention. So there was a Yale group, Doctors John Crystal and Berman and colleagues started using it, and they did a pilot study not knowing what to expect, and they gave it to a bunch of patients who were clinically suicidal. And they found it stopped their suicidal ideations completely.
Wow.
Like not just no drug. We don't have a drug like this. And so in the early 2000s, they did a bunch of testing and papers came out, and lo and behold, it helps treat depression and it helps stop suicidality. No, we don't, you can give antidepressants and you got to wait 4 to 6 weeks for them to even work, if they do. And then, of course, you have therapy. You always include therapy with all this. But anyway, point is, to go back to your question, like what's the difference between this drug given to, say this young child, young adolescent for his depression? It's done in a controlled environment with a controlled rate of infusion and a controlled dose with appropriate monitors and supervision and therapy given in and around it, before it and after it, where the people bungee jumping through the K-hole has nothing to do with the proper use of clinically administered ketamine. That's what I like to tell people. They are just two different species.
Okay.
Even though they're the same drug.
Many questions already.
Yep.
First and foremost, you mentioned SSRIs, or you didn't use it by name, but I'm assuming you were talking about SSRIs, and you
Correct.
do need to have a long period of that being in your system for it to work. And I have friends that take SSRIs, and it's changed their life. Right? It has.
Oh, they work, I mean,
yeah, they do work, but it doesn't. It's not a cure-all. So we get that. You don't go to the clinic. You just start taking it, and before long, you start feeling better. And some people feel so good they think they can go off of it, and they go off, and they have a problem again, or even more of a problem. And if they don't titrate off correctly or try to do it with the doctor, so. We'll get back. I want to get you seem to have a lot to say about that, so I'd like to hear it. But now you're saying that, okay, now I need to know the mechanics. So you're not huffing it or you're not sniffing it, with a bunch of friends on Saturday night. How is it how do they administer it? Do you have to stay in the hospital or in a clinic for any period of time? And then after you break your suicidal ideation. Does it work for some period of time, or do you have to keep doing this? Give me the ins and outs of what they know about this drug.
Okay, so
suicide, the drug and suicide.
Right. Yeah, there's been, so I think the best way to answer that, how there's many ways it helps suicide. There was the main study of it was the NIH will to live or will to die study. And they did it, the NIH actually did the study showing conclusively that the people who took the ketamine, again, given with therapy, proper therapy, it's so important to highlight that. The will to live group was so much higher than they expected that it just was obvious that it worked for that. And then and later on there's been other studies like Lori Calabrese she's a psychiatrist out of Connecticut, treated almost 300 suicidal patients in her clinic over some years, and she showed that she stopped suicidality or suicidal ideations, that thought of I want to kill myself, in about 80% of the patients. And in about the other 20, it didn't stop their suicidal thoughts or ideations, but none of them went on to kill themselves. None of them needed to be admitted to, say the hospital or Baker acted, and then none of them went on to kill themselves. And that's
okay. So hang on. We know that medicine. She had a 100% success rate with this drug.
Pretty much, man.
Not 80%. If 300 people did this and no one killed themselves,
nope.
That's huge. Medicine does not try to get to 100%, right? Mm-mm. But here we are with one small study of 100%. Are there any other studies like that where someone got similar? And can you mention those?
Yep. John Crystal's done some of those studies, Berman, the Yale, the Yale studies have all replicated that to some extent. there's, I did a speak, a kind of a TED talk on it actually. And I mentioned some of these studies, they're not all as clean as, say, the one I mentioned with Dr. Calabrese, but they all have the same trend. They stop suicidality for some period of time. In some cases, it was 24 hours. In some cases, it was weeks. It depends on the person. I mean, if the ingredients for suicide are you're hopeless, you feel like you're a burden on society or the family, you're isolated, and you have the means to take your own life, and you're put into a vulnerable situation which brings all those together. Just go back to the lockdowns, and that's what that was.
Right.
So you need certain ingredients to want to take your life and be successful at it. And what I like to say the ketamine experience does is change the hope equation. I don't think you can come out of a ketamine experience without some kind of change in hope. Because it's like other psychedelics like ayahuasca or MDMA or DMT or other things like that. The experience involves you go outside of your head into some consciousness that's hard to explain, but it's, call it what you want, an oceanic feeling, these feelings of like waves are all around you, but you get it real quick that you are a speck of energy in this whole cosmos. And to think that your problem, is so big. And then when you're almost kind of outside looking down at yourself, or however it is, some people, and the other thing about it is, you lose ego, you lose sense of your importance of your own self. And those are all characteristics of a psychedelic experience. And that's what all these medicines can provide. And, so anybody who tells you they went through an ayahuasca treatment, that's kind of what they're describing. And some of the same things, although not all exact, happen with a ketamine treatment, properly given, properly dosed, and that kind of thing.
So, all right, I have again, this is all.
Keep going.
There's a guy I met. I went out with a couple of guys. We did a guy night out. I don't know. I moved to Central Virginia. I don't know that many people here. I got invited out, me and a couple of guys. And this one guy, as a matter of fact, we swung by his house to pick him up. Guy lives in a beautiful home, very expensive cars outside. So obviously the guy's done well in his life.
Yeah.
And we're sitting there, and perfectly delightful guy, and I'm having a great conversation with him. And he told me he just got back from, I don't know, Chile or somewhere, and he had an ayahuasca retreat and experience. And I'm like, what the F are you doing? I thought this was for, I don't know, hippy dippy people, wear patchouli oil and hair under their arms, even if they're female. And what are you doing? And the guy, and this broke my heart in ways I can't even begin to tell you. He goes, I lost my son a year ago in a freak accident. He was going to be a senior in high school. As a matter of fact, this other guy, his son, they were in the same class. That's how we know each other. And it broke my heart in ways. And he goes, I can't come to terms with my son's death. I'm having trouble coming to terms. Yeah. And I said, did it help? And he goes, yeah, it did. It really did. And I think I'll be back again. I'm going to go back again. So my question is with the ayahuasca, and I don't want to get too far away from ketamine because we're not off of that subject yet, but this guy saw that it helped him enough that he's going back again.
Yeah, you can. Yeah.
Right? So how do you have to keep going back? Because I can't imagine losing a kid, right? No one, I don't think any parent can imagine that. So how do you deal with that? And do you have to keep going and doing this ayahuasca thing for the rest of your life? How does that work? I don't understand how drugs work because I've never taken drugs.
That depends on the individual. I think it's a good question. You know, do you have to keep doing this? In most cases, no. You know, usually with ketamine anyway, most people need like 3 to 6 treatments max. But, you know, take some guy like Matthew Perry, for example, who, you know, it's a good case to discuss. He was taking ketamine for years, like 5 or 6 years before his death. And why? He's quoted saying, he goes, I would rather I preferred dealing with the near-death experience I had with ketamine than the thought of taking my life by suicide every month.
Wow. Do we know what his demons were? Was it a childhood problem? Because I was in Hollywood for a lot of years. I did not know Matthew. I knew a lot of people around Matthew. Matter of fact, I trained the guy who created the show, right? One of the three, right? Kaufman Crane, one of those three Kevin Bright was my client. Everyone loved this guy. Everyone I know loved this guy. Yeah. Why couldn't he love him? What was his malfunction?
Whatever it was in his maternal life or something, he just had a lack of, you know, usually it's from the maternal side or sometimes, I don't know his childhood history, but usually when people don't love themselves, it stems from something like that, you know?
Yeah.
And then you cover that up with years of addiction, which he certainly had, and he had several addictions. And he just, you know, he went through his whole career addicted, you know, and sometimes, you know, you find that you don't maybe not act as well, you know, without being on these substances or not. And you just, or you become, in a sense, your confidence is lost without it. And I think that must have happened to him, I would imagine. And so as he was, you know, trying to, gosh, he did so many great things. I mean, he opened an addiction foundation, helped hundreds of people that I know of. And, you know, and I wrote on my Substack about Matthew Perry's death. And when I saw the coroner's report, they kept saying that it was all due to ketamine. And it's true. He had a huge dose of the drug in his system at death, but you got to understand, he drowned in a pretty shallow jacuzzi. He also had some other drugs on board. He just got done playing pickleball a couple hours. And the coroner report didn't show any IV lines or, you know, like somebody coming over to give him ketamine or, you know, and he knows how to get ketamine. He's been doing it for years and he has doctors, you know, that kind of thing. And he had no muscle like shot marks that would have suggested he intramuscularly dosed himself or somebody else or whatever. Yet he had this huge, you know, he had a pretty good level of ketamine. And then it was found that, you know, they say it made him so euphoric that he drowned in the jacuzzi. Well, I can tell you, I've seen death many times, you know, in ERs and trauma, and, you know, I know what happens. And people close to death get this, what's called a hypoxemia or hypoxic survival reflex. And I don't care how high you are. When you're close to death and your lack of oxygen, you wake up. And I was just like, really? He couldn't stick his head up above a foot of water, even when he, you know, somehow he knew he was going to die. So, something else stuck out at me. And then also, sure enough, the coronary report showed that he had blockages in his heart. So did he have some, you know, heart did it trigger a heart attack at the same time? And that's why he couldn't respond, just a lot of it didn't make sense. And then on top of that, and whoever his assistant was or is, or people around him, took all the ketamine paraphernalia, because when the police came, guess what? There were 0 drugs on premises except for those that he was prescribed, like the Xanax and the buprenorphine,
right.
And that was it. And so it's like, a lot of it was suspect, and I talked to, some of my friends in Hollywood who knew what was going on, and they all said kind of the same thing. And that's what sparked me to kind of write about it. And I said, let's just think about this from another vantage point. And it got a lot of attention. And I said, I don't buy the whole ketamine overdose thing, because it doesn't stop you breathing. It does make you euphoric, but like I said, it's even at that dose, I think you would still be able to put your head above water. Maybe a deep pool I could understand, but this, I don't know. It was a jacuzzi, and I'll stop there. But maybe if you have comments or questions on it.
No, I just I feel sad. I don't so you don't think anything nefarious happened. You don't think anyone drowned him or anything else, but you just think he might have had a heart attack to go along with ketamine.
Something, yeah.
Yeah. So it's sad all the way around. There's no bringing him back. It's just sad that someone with all of that money that could get help. It just shows you that all the money in the world and all the help in the world will not stop you from, dying if, it's just very scary that no one is above it. Right. So, yeah, it's upsetting. I want to switch gears a little bit.
Okay.
If we can. And I want to talk about how you feel about low-carb diets. I want to hear how you feel about being in ketosis. I live in ketosis and have done for a lot of years now, 17, 18 years. But before we do that, I need to tell the audience to go out right now and buy Villa Capelli olive oil. Villa Capelli, look, if you're going to be in ketosis, we're getting ready to talk about that. You need to have the best olive oil on board, and that would be Villa Capelli. Listen, there are other great olive oils out there, but I can't go vet them all. People ask me all the time on X, hey, man, Villa Capelli, but what else is out there? It's like, look, I can't go vet every olive oil. Can't do it. But the United States allows you to cut an olive oil up to 40% with any kind of seed oil and still call it 100% pure. So you'll see Bortoli's 100% pure olive oil. They've added a scent to it because seed oil smells like rancid oil. And they've added a color to it to make it look like olive oil again. You're not even close to olive oil yet. On the package, it'll say 100% pure virgin olive oil. Not true with Villa Capelli. We know that this stuff comes out of Puglia, Italy. I vetted the company myself. I used to know the owners. One of them died. Now I know the owner. I use this product in my vitamin D over at my company. So if you want the best olive oil on the planet, go get Villa Capelli. You want to save 10%? Put in promo code Vinnie, VINNIE. 10% off every single time. Promo code Vinnie. If you spend more than $125 after the discount, I've done the math, spend $140 minus the discount, you'll be over $125. You'll get free shipping. Villa Capelli, let them know we sent you. Promo code Vinnie. We're talking to Johnathan Edwards. I've learned more about ketamine than I've ever wanted to know. Now we're going to go from ketamine to keto. It's odd that they both sound similar, right?
Yep. Just a letter off. Yep.
And, look, Mary Newport. Do you know Dr. Mary Newport at all?
I've seen her speak, but I've never had the pleasure of meeting her, but I love her work. Yeah.
Wonderful woman. She's been on this show, I don't want to say dozens of times, probably 5 or 6 times. She's in my latest documentary, Dirty Keto. Mary Newport turned her husband around. Her husband had dementia and used coconut oil and coconut oil alone, along with a low-carb diet, to reverse what was going on with him and kept him healthy for a lot longer than he should have been. Where are you with keto and eating that way when it comes to mental, physical, the whole deal?
Well, as we were discussing, I first got into ketogenic and keto diet, so to speak, through my residency in Utah with brain injury. We treated enormous amounts of ski head injuries, as you can imagine, being in Utah. And, we were using ketones in the IVs, to abate some of the brain inflammation that happened with some of these traumas. So I already knew from a brain inflammation standpoint, ketones were, a treatment modality. And then at that time, I really didn't think much about being on a ketogenic diet. It really wasn't a thing.
What year was that, Jonathan, by the way? Was
2000.
2000, so way back when. Were you guys using salts or esters in the IVs?
I believe they were ketone salts. Yeah.
Okay. All right, but when you're going straight into the bloodstream, was it intramuscular or intravenous?
Venous.
So you're going through the vein and you're popping it right into the brain. So a salt would probably do just as well as an ester at that point because you don't have the stomach to contend with.
Correct. You bypass the liver, everything. Yep.
Yeah. Okay, good. I just wanted to figure out. So you guys were sticking this right into the bloodstream, getting it to the brain, and what did you see?
The results, you saw some improvement in brain inflammation and some of the things we measure, like CRP and some other, TNF alpha, those kinds of things. At least that's what, are in the studies. There's more going on with an acute brain injury. So it's, people are having seizures. They're having, they're sedated, and when an acute brain trauma is kind of like a heart attack. You got to calm down the muscle, in a sense, to abate further damage. So to answer your question, you don't really see much from the administration of the ketones right away. It would be months after, like how the brain would heal. And then this was the beginning. There weren't many research. There was some research around it, but I can tell you that this is the very early, late 90s, 2000s that this was happening. So, and the studies are out there if people want to find them. So the question is, no, I don't think you're going to see much acutely right away. It's it'd be 6 months, year out, 2 years out. I think where you would continue the ketones somehow, that you're going to see an improvement, say, if you didn't use them.
Okay, so so we know what ketones do when we ingest them, right? So, and we also know that we can make ketones from fats, right? We can, we turn the fats into a ketone.
Beta hydrox, yep.
Yeah. So, and we know that we could do that a lot quicker if we take in medium chain triglycerides. We all know the tricks, right? Everyone listening to this podcast knows the tricks. Is there any value to taking a ketone ester or a ketone salt?
Yeah, if you don't do it, if you have a hard time doing it, that was the whole thing with Dr. Volek and Dr. Finney. They wanted to come up with a way to, so people could, in a sense, not have to be so strict on the ketogenic diet and still be in ketosis. That's all still panning out in the studies of whether that's truly possible or not. I think the best way is just to stick to the diet and be natural about it. That's where you're going to get the most benefits. When it comes to things like cancer, though, things like brain traumas, depression, other mental disorders, weight loss, I think they have their place. I still, but again, it's a supplement. It's not the medicine. It's not the diet. The diet is where you get your nutrition. The diet is where you get your health from. You take supplements to do just that, supplement the diet that you're trying to stay healthy with.
Right.
And I see ketones kind of in that same, like it's a supplement. It doesn't take the place of a well outlined lifestyle and how you live around, in a ketogenic diet.
Yeah, I feel, people ask me all the time about the salts and the esters, and I always say, look, if you're going to do one, do the esters, but good luck chugging that down because it is not going to taste good and you may want to gag. But you could get the same result by just being on a very low-carb diet and adding in some medium-chain triglycerides like a simple coconut oil. You don't have to get refined MCT oils, which will give you the shits if you go a little too hard on those. You can just have a little coconut oil a couple of times a day and literally end up in the same place. And I've had D'Agostino, he was one of the early guests on this show. Probably he's been on more than anyone else. And he was one of the guys that was developing this stuff for the Navy, for the Navy SEALs and the whole thing. Yeah. And he was like, you don't need to take the esters. Don't waste your money. Don't waste your time. Just eat a very low-carb diet and up your medium-chain triglycerides in the form of coconut oil. And you seem to be agreeing with that, or am I putting words in your mouth?
No, I completely agree with that. And I've talked to Dominic about this as well. I think the only place I might not agree with it is, say, if you have cancer and you want to be, in and you want to get your glucose ketone index to a certain point because you're trying to battle the cancer. Mm-hmm. I think supplements like salts and esters have a real place there. And I've had a couple experiences, amazing ones, amazing stories, actually.
Well, let me tell you my story, and maybe I should be taking esters right now. I'm on the backside of leukemia for the second time in my life. Mm-hmm. The first time was in 2007, and I beat it, no problem. And they told me it would be back in about 5 years. But somehow I made it 17 years, and back in early April of this year, I found out, okay, your blood numbers are off enough. They did another bone marrow biopsy and found out, okay, we need to go nip this in the bud again. This time, chemo was a lot easier, even though they gave me exactly the same dose, because I wasn't as sick, meaning my blood numbers, I wasn't almost dead like I was back in 2007. They caught it early enough. Wow. I ate on point. I stayed in dietary ketosis. I'm through all of the, I took cladribine. That's the, what they give for this. Yep. I'm on the backside of cladribine. They took me off of all of the drugs. I haven't been on an antiviral or an antibiotic because it was causing hives all over my body. They gave it to me for a very short time. They took me off. My neutrophils are in a safe area. As a matter of fact, I have to fly again day after tomorrow. And the doctor just gave me, I have to go in every time before I fly because I'm not on an antiviral. And they check my neutrophils every time to make sure that I'm strong enough to fly. Meaning if I get COVID or the common cold or something, I won't die from it. My question is, should I be taking ketone esters on top of that right now? Because I haven't been. I'm exercising again. I don't know how I'm exercising, Johnathan, because my hematocrit level is only back up to 38. I'm a guy who enjoys 48, 49. I know that sounds crazy. Mine is always high. I'm at 38. That's the highest I've seen. My white blood cell count is still below the normal level, like in the danger zone. My platelets have come back just a little bit. By the way, I've been taking B9, B6, B12, just exogenously as much as I can, just all of it, trying to get my red blood cells back but nothing seems to be moving back very fast except the neutrophils. Is there anything I can do that you know of, including maybe being on ketone esters, that might help?
Well, for leukemia, that's a specific deal. And I mean, when you brought it up, I was like, wow, I don't think I've ever heard of ketogenic diet, for the protection of acute leukemia patients. And just when you said that, I actually pulled up, there was a 2023 study, already suggesting that metabolic ketosis is compatible with the induction of chemotherapy for at least AML patients. But, it's, who would kind of know more than that is, you might know Thomas Seyfried.
Tom's been on the show a couple of times.
Yeah. I've met him several times, and he would be the go-to guy for that. When you're talking about brain cancer, when you're talking about bladder cancers and other kind of tissue type cancers, not to say, blood is a tissue. Absolutely. Right. But you know what I mean? When you get solid, we'll say solid tumor, tissues, there's no doubt that having a good ketone index, as Tom points out, in his book, The Metabolic Approach to Cancer, and I have some incredible stories. I helped a good friend of mine who's passed now from astrocytoma, but we actually developed a ketone salt together, and he subsisted on that for many years, and it helped him. And he was strict keto, man. It was a lot of we went through a lot together. And then I had another herbologist who had bladder cancer, and we used those salts that we made, and he kept his ketosis always, say, above 6 region. Yeah. And they went back to go look for his muscle invasive bladder cancer. And I was the anesthesia. I mean, I was right there. I watched the biopsy when he had it, and I watched him try to biopsy 6 months later. He of course refused all the, they were going to take his bladder and all this. And so 6 months later, man, they went to go look for the lesion. It wasn't there.
Couldn't find it. Well, look, I think I'm somewhat of a miracle, because they told me 5 years. They said, look, we're calling remission in your case. They said, we're calling remission, the fact that you still have it somewhere in your blood. We can't, in your bone marrow, we just can't find it now because it's so low. We've kicked it back, but it's going to grow back. And the rate it grows back, 5-6 years is what, if you get 5 years, they said, consider that a win. 17 years, and no one's questioning anything. It's like, as a matter of fact, I have a doctor here.
Nobody will question.
And Johnathan, can I tell you what happened? My last doctor was a research scientist at Cedars-Sinai, and she was the one that told me, she goes, when I was leaving her office the last time, she goes, I said, hey, Doc, is there any truth behind any of the drinking wheatgrass and all this stuff all my nut job clients are telling me? And she was like, no, there's no science behind that. And she said, oh, aren't you the guy, because I was well known in Hollywood as the no sugars, no grains guy, NSNG, right? That was my thing. And she goes, aren't you the no sugars, no grains guy? My friend was telling me that you work with celebrities. I went, yeah, that's what I do. And she goes, do you follow your own advice? And I said, nah, I'm a cyclist. I do these ultra cycling races, and I need some sugars to get through these races and all things. She goes, well, if you could cut out sugars and anything that causes sugar in your body, like a grain or a potato, you can probably keep yourself healthier for longer. And I said, well, this was back in 2007. I said, Doc, what say you? And she goes, well, you're going to start hearing about this. It's not out there yet, but we're finding out that cancer feeds on sugar. Exactly what Thomas Seyfried says, right? Yep. They take, it's a closed cell, and, it's a carbohydrate, carbon, hydrogen, and oxygen. It's pulling the oxygen to grow from the carbohydrate. And I was like, well, I can try that for a while. And the only time after that I ever had sugar for that first year was when I was on the bike training. If I was off the bike, I didn't have anything. And I was even able to sometimes be in ketosis like that. 17 years. I'm now with the doctor at UVA, great guy. And he made a comment. He goes, 17 years, you never see this. I said, interested in knowing what I did? He goes, nah. And we're good.
Of course. I knew that was coming.
Yeah, because I said to him, I said, no interest whatsoever. He goes, I don't want to hear it because everyone comes in with what they do and what they did. But you got to understand, Vinny, you're an N1 experiment. And I went, okay. But isn't that how it all starts? I mean,
right.
Robert Atkins had one patient that lost a shit ton of weight. And he said, what did you do? He read the letter on corpulence and he lost all the weight. And that's how Atkins started with N1 experiment. But no one's interested in my story of 17 years. I might have a record. I know a guy, you mentioned the word glioblastoma. I have a friend, matter of fact, a lot of people who listen to this show knows him. His name, his stage name is Bald Brian. His name is Brian Bishop. He was on the Adam Carolla show for years. He's the longest living person with a glioblastoma, and he's at like 13 or 14 years.
Wow.
You know, most people die in 6 months. Where his is located, 6 months.
Yeah, my friend John Mahoney, he was should have died in 3 months, and he was alive over 7 years for that. Yeah.
By comparison, the same hospital that Bald Brian goes to, or still goes to, Cedars-Sinai, my good friend, who was a titan in Hollywood, got the same glioblastoma. They gave him the same 4 to 6 months that Brian got. He gave a donation of $14 million to the cancer center at Cedars-Sinai to immediately put him on all of the drugs, all of the, special, anything you got, throw it at me. But every time I went to his house, he was still eating dessert. He was still eating pasta. He was still drinking, all of the stuff. And I said, you're doing all of the other things. He goes, listen, if $14 million isn't going to save me, I'm going to have Oreos. Okay.
Wow.
And by the way, 3 months, they gave him 4 to 6 months, 3 months. I went to his funeral. Love the guy. I still cry. He gave me a silver loving cup one time, and I still look at it and think of him. He's gone, right?
Yep. Just I don't care how much money. It's so simple. It's too simple, right?
Yeah.
And it's sad. We're just coming to the research on this kind of stuff now, and thanks to people like Seyfried, Dominic, some, Finnick, Voley, all those guys. And, it's all, it's coming around for sure. And if I had cancer, and you just got to live long enough and you will, all humans get cancer at one point if you live long enough. Yeah. And, that's, I don't see, I was at Moffitt Cancer Center when I was a resident there, and I'll never forget there, because they tell you to gain all this weight before the chemotherapy for the breast cancer patients. And I met, years later, I met a veterinarian. He was, in the, we were in Dominic's meeting, the Metabolic Health Summit. And he had the same story. The dietitians there tell you to eat as much cake as you can, to eat as many cookies as you can. Why? Because you have to gain that weight before the chemotherapy. Yeah. And you're just like, are you, where in the hell does this come from? It's just like, it's the most, excuse my French, the effed up advice you could ever give anybody. And, and his wife didn't last long. And I know many other patients like that, they don't last long. And to be, it's just, I think it's going to be considered malpractice one day to be so careless of a diet in the face of a lethal cancer.
I was in the infusion center every day getting this junk pumped into me. And you sit in this nice, comfortable chair. I would bring a computer so I can watch a television show. My wife would load in a television show for me or two. And because I have to be there for 4 hours a day. And they come in. They're super nice. It's like, hey, anything you want to eat? It's like, what do you mean? We have sandwiches. We have this. We have that. Any kind of cakes or candy you want, just let us know. Here, we could get it from the vending machine for you. And the first day I said, you have coffee? And they said, yes, we do. So they brought me a nasty cup of coffee in a styrofoam type cup. And I only drank it because they poured it for me, right? But the next day I showed up with my own thermos and my own porcelain. Actually, it was a stainless steel cup. Because it's like, wait a minute, you're trying to kill me with this styrofoam, polystyrene. I don't need that in my system. And your coffee tasted like crap. But every day they came, would you like a sandwich? Would you like some this, with that? And by the way, I can see around the curtain because I would have to get up. I'm 62. I would have to get up every hour to go pee. So they unhook you and you pull the cans. You're wheeling.
You hold it like a football, yeah.
Well, yeah, you're rolling the thing in with you, to go pee. So I'm walking by everyone else. Everyone else in that cancer center had a weight problem to some degree, and everyone else had food hanging out of their mouth, wrappers all around them. I get it. You're sitting there and you're bored. But isn't that the same boredom you get at home? Because they all brought a computer with them too, right? Yeah. They were, can you not just watch a program and that be enough? Do you have to have food going in your mouth while they're trying to kill something that's killing you? Right. But that's where we are. And I get it. Hey, would you like some cake? Would you like some Oreos? We got it all, right? But no, that's not what they're doing. As a matter of fact, when I started bringing my own coffee in, Johnathan, they said, you didn't have to bring your own coffee. We have coffee here. And I was like, yeah, I know. Yeah. I'm a coffee snob. I just brought mine. I'm sorry, Yeah,
it was probably juice of sock water. That's what we call it in French, jus de chaussette.
Or as my grandfather used to call it, pipi lapin.
Pipi lapin, exactly.
For everyone else, I think I just said rabbit piss.
No, the Italians say the same thing.
Yeah. So my grandfather was Italian, but we grew up in French Louisiana, down deep south. So everything was pipi lapin. At any rate, I want to switch gears again. Are you good to go for a while? Because I'm loving you, brother.
I'm good. Yeah.
Okay. I got other podcasts to do, but I can't get enough of you. We might have to have round 2 with you, but I want to say words I don't understand.
Okay.
Percutaneous hydrotomy. Did I say that
hydrotomy.
Right? Did I say hydrotomy or hydrotomy?
Hydrotomy.
Percutaneous. Did I get that part right? Percutaneously.
Percutaneous.
Percutaneous.
Yep.
Okay.
Yeah.
Now, that's not French and that's not Italian. That sounds more Greek to me. So you tell me what we're talking about.
Basically, percutaneous hydrotomy is a French technique I learned in France. And it was originally designed for the treatment of chronic pain, like back pain, knee pain, shoulder, frozen shoulders, that kind of thing.
Guilty.
Yep.
I got myself a lot of pain.
Yes.
Yeah, I live in it.
Suffer from pain.
Okay.
So it's as easy as this. Percutaneous means through the skin. Hydrotomy means to add water. So what we're doing, it's a technique that stems from the technique of mesotherapy, which you may have heard, and that's just very small needles medicines placing under the skin, basically. It involves the treatment of what's called oligotherapy. So you use vitamins and minerals. It involves tumescent anesthesia, like they do on plastic surgery. So we all know about that. And it involves.
Don't pretend we know. I don't know what that means. I know what tumescent means, but does it mean to pump up under the skin?
Bigger. Yeah. Yep.
Okay.
Up under the skin. So all it is, it's a technique to place. What we place is like physiologic salines, anti-inflammatories, some local anesthetics, minerals, vitamins, sometimes some corticosteroids if necessary, depending, and some other medications. And then we put them in the soft tissue compartment. Say if you have a knee pain or back pain, we'll use small mesotherapy needles, and we'll infuse a certain amount of this solution under the skin to act as a slow release depot. So it's just a slow release mechanism of a solution, that is in proximity of the pain, of where your injury is, of where the cells are pissed off, for example. Like, if you got knee osteoarthritis, your cells called chondrocytes are not happy. They're making pain receptors and they're making inflammation. And so when you step a certain way, it hurts like a son of a bitch. And so, so if you imagine that's all it is. It's nothing more difficult than that. And we use it for some other medications like rheumatoid arthritis, like methotrexate's delivered like this sometimes. Sometimes monoclonal antibodies are delivered subcutaneously under the skin like this. Right in the backyard of Los Angeles, you're not there anymore, but UCLA, Roy Altman, when he was alive, he did a big study showing that just saline helped injuries. Like, they used to think saline was just a placebo. It did nothing is what they thought. And in fact, he showed in many, many studies, and others have too, that it doesn't, it actually has a healing effect. The cells, and it actually you could even go back to cancer. Chronic cells and cancer cells all have different levels of water inside their cell that are not optimal, not consistent with what a healthy cell would have. So it kind of gets in the weeds, but in a sense, you're treating the cells in this case, and I always try to. It's not a miracle. It's something you can add. You can add to, say, like physical therapy, PRP shots.
All right, so that's what came to mind. So let me break in here. Yep. PRP. We know that it works some amount of time. We don't know how many, some people get good results from it, but other people, you mentioned just putting in saline solution and that works, but we know that dry pricking in a lot of cases works as well as PRP, yeah. Right? Yeah. All right, so I'm a guy that's in a great amount of pain. Just to give you my short resume, I played football through college. I broke everything. And by the time I was in my late 20s, I had a mountain bike contract, and I rode mountain bikes professionally for a short period. I was an ultra cyclist for the better part of 15 or 20 years. I've tried to fuck up my body every which way you could and still be upright. So I'll give you my two main. My right shoulder's been completely replaced, and I had the famous Riemann run surgery done on that by the guy who invented it, Dr. Mattson up at UW in Washington. Very controversial surgery at the time, but I'm a guy who could not shake your hand with my right hand because I was frozen to the side. I was in pain from the time I was 35, which made mountain biking very difficult, made everything difficult. Yeah. Right? Now I can do pull-ups. I'm 62, and I can get on that pull-up bar right behind you and wrap off 15 controlled pull-ups right now. And they would say, how are you doing that, right?
That's awesome.
I'm lifting weights again. I'm doing everything. So, all right, so that's fine. But I have two areas where I'm in pain all the time. Lower back, ta-da, just like everyone else.
Yep.
And my neck. And what happened was just one day my neck started hurting really badly. Like instead of just kind of hurting, like lockdown hurt. So went to a neurosurgeon. They did MRIs. They did everything. And they said, okay, you have bone on bone on 3 of your vertebrae. And obviously there's a nerve pinching between one of those 3. And you're going to be in pain. How can we fix this, Doc? We can go in and we can insert these little things to
these rods to make space. Yep.
Yeah, we can make space, and then I don't want you that close to my spinal cord. I'm good, right? So they said, okay, we can send you to a pain management guy, And I said, okay. So I went to this guy and I said, listen, I'm here because they told me there's some exercises or something you can show me. And he goes, yeah, no, we really treat people like you with medication. I was like, so so he's offering me like class 3 narcotics. It's like, well, I'm supposed to walk on fucking high and constipated? I'm not going to take this stuff. He goes, well, there's nothing else you can do. I came home. I believe in being super hydrated to help all of these ailments.
Yep.
I take my own electrolyte that my company, Pure Vitamin Club, makes. I take it winter and summer. I take it all the time. And if you notice, I keep 40 ounces of water next to me all the time, right? That helps. I also created a number of neck exercises, working everything from the sternocleidomastoid in the front to every muscle around and in the back and every which way, using weights and pulleys and stretchy bands and harnesses and everything else. I virtually pulled myself out of a nosedive by moving my neck every day, by drinking a lot of water, by taking a lot of electrolytes, but it's not perfect. No. It's not even close to perfect. My question is there a way to do even better? Not only for my neck, but for my lower back, which is a whole different amount of pain.
Yep. I like to start off with, when I talk about these things, it's all about keeping energy in motion. If you ever read the Nobel laureate Albert Szent-Györgyi, he was a Hungarian physiologist.
I have not.
He said, he's one of those geniuses like Einstein, just in the field of medicine and physiology. And he said that in every culture before ours, human healing has always taken place with the movement of energy.
Okay.
So healing always involves moving energy. If you're unable to move energy, then healing is never going to be optimal. So I always keep that in mind, when I'm thinking about the healing process for anything I do, really. So when you think about something like percutaneous hydrotomy or anything, a steroid shot or, these fancy nerve blocks they do, it's about keeping you moving. It's about keeping you with the ability to be able to do your therapy, to be able to, say, do your back exercises or just exercise in general. And because where people get stuck in a rut, they hurt so bad they can't move.
Right.
And so one thing that I've seen across the board, and and some people you've had on this podcast, I've treated their loved ones, and same thing. They've had back pain, and I treated their back. So basically, it involves putting a large amount of fluid in the back with the mesotherapy needles. Usually, I have like 8 ports, and I'll put local anesthetics. What does that do? Local anesthetics breaks the pain cycle. What does the water do? The water is able to diffuse down into the cells that are pissed off and even hydrate. Some of it is taken up by the cells, we'll just say. Minerals. The cells need energy. They need cofactors like selenium, magnesium, zinc. They need vitamins. You add in amino acids, all those help the cells. You also add in anti-inflammatories like Toradol. In case people who have like nerve involvement, you might add a little bit of Decadron, which is a steroid, but you use a tenth of the dose than, say, you would get in a pain management shot. And then you can use some other things like pentoxifylline and some other medications that I won't get into the weeds about. But what I can tell you is each person, that not everybody, and it's not a miracle, but when most people do this treatment, they feel like they have better function. They can move better, and their pain is decreased somewhat. And some people have great responses, and some people have just okay responses. And it just depends on, where your pathology is. Are you bone on bone, or, what's going on? And it's pretty neat to see. And then, so the fact that you can keep somebody exercising and moving is the key. And I think that's something what percutaneous hydrotomy, and other modalities, help with. And that's basically the crux of it. It's not more complicated than that.
Yeah. Look, I get on my floor every day. I know this sounds weird, every day. Yes. I keep a yoga mat on my floor. because I still work my shoulder because I want to wake up in the morning and get some synovial fluid moving right away.
Yep.
Before breakfast, the shoulders worked on. I do some stretching. I try to release my lower back a little bit. I roll on the pad, and then I do some stretches. Do you know Stephen Hussey at all? Dr. Stephen Hussey?
Yeah, actually, I had contact with him while I was writing the book because, I kind of go in there about, what he's big on, the heart and, the structured water. And I actually had contact with him and Gerald Pollack while writing my book.
Well, all right. So Stephen, right? And I've been at parties.
Yep.
They'll have parties for, people that we're all speaking the next day. There'll be like a speaker's party at someone's house. I've been at someone's house and Stephen will go, just get on that chaise lounge right there. And he'll like manipulate my neck and it sounds like, he goes, and he does it. It's more cracks than you've ever heard, right?
Yeah.
And I get up, and then he'll say, wait, let me do your lower back, and, just popping and cracking and do all this stuff. While I'm sitting there having a drink, he'll just lay here. Okay, I went to a chiropractor here, and this guy couldn't do anything. So they're not all equal, right, when they try to move you around. And I'm trying to explain to the chiropractor, you're tight. It's like, listen, I just did 90 minutes of stretching in my gym before I walked in here. I should be nice and loose. I've even tried things like an hour on my bike. You can't be. The only thing I'll do is get off the bike, dry off, run to his office. You can't be any more warm than that. Oh, you're tight. And I'm like sitting there going, you're not getting it. I know a guy that can, at a cocktail party, that can, open me up, and you're not doing it here. I need someone who can work with me, and I'm wondering if this is not a good thing for me to do. Where are you located, by the way?
I'm actually I have two places I practice right now in Florida and also in Las Vegas.
Where would I be close? What part of Florida? I'm trying to figure out.
Like Daytona area, the East Coast there by Cape Canaveral, where
yeah. Because I got a nephew.
The Rockets.
I got a nephew in Destin. That's probably 4 or 5 hours away, I'm guessing.
We'll work it out, man.
I'm willing to try something because, I'm always in peril, and I work out every single day. You're looking at a guy that does not miss a day, right? Even through cancer, I was much slower, but I was getting on a bike or a rowing machine or something every day. I don't want to ever stop, right?
I'm like, well, just so you know, I'm a former Cat 1 cyclist, and I've raced against like Floyd Landis and those guys in the California pro scene. So when you bring up cycling, that's I'm right. We're on that same suffer page.
Same page. Where were you? Where were you in California?
I was born in San Jose. I grew up in Victorville, Apple Valley. I went to university at Victor Valley College and then off to UC Davis. And that's where I got into cycling. And it was like, it's one of those things. I was a good runner. I did a 2-hour 30 marathon, in college. And then it got to, I started cycling at UC Davis, and I quickly got it. And then the decision came like, well, should I go pro or, go on to that or go to medical school? And I was like, I thought for a second about doing the cycling thing. I was like, yeah, no.
Davis is one of the cycling capitals of the world. I mean, there's more cycling there.
That's where I did. In my 30s, I built myself up, from Cat 4, 5, 3, 2, and then 1.
Yeah. And
I raced the California State Championships. I raced, the Gila, the Tour of the Gila, and some of those hard, that's where I, would race against some of these pro guys. And, I did, it was, so the cycling is a really big part of my life. And I've been the team doctor actually for AG2R, Fly via Australia. And, I've done the Tour of California 5 times. So so it's a big part of my my repertoire, if you say.
Yeah, we could probably sit around and talk about cycling all day long. I refuse to get on a bike anymore. I keep threatening to get on a gravel bike now because I'm so sick of the road and everything else. But I was thinking about getting a gravel bike and trying that, but you get old enough and it's like, the spinner's good enough. But someone was asking me the other night, it's like, oh, you've ever been on rollers? It's like, yeah, at one time we only had rollers. Right. It's like, it's like they don't realize what we've been through with cycling. But yeah, Davis was a great area. One of the first guys to ever ride in the Tour was from that area. Johnathan.
Oh, you mean Steve and you're not talking Vaughters.
No, not Jonathan Vaughters, but Johnathan. He ended up getting into some kind of trouble with some child or something, some weird thing. But
I know who you're talking about.
But his name was Johnathan, right? Johnathan. He was like the first American, even before, what's his name went, Le Mans.
Right. You're talking Jacques Boyer.
Boyer. Yeah, I kept Jacques Boyer. And by the way, he was in one of the early, he came back from Europe to be in the race across America, the Ram.
Yep.
And he got beat by Pete Pensears, and he said, "This is not a bike race; it's a sleep deprivation contest." Yeah. Which is what it was. I've crewed for my buddy in Ram. We all we were so deep in all the ultra stuff at one point, but Jacques was from that area too, and people forget he's probably one of the first Americans to go over to Europe, which paved the way for Le Mans and the other guy who won the he didn't win the Tour of Italy, but he won a stage on a snowy day in June.
Andy Hampsten.
Yeah, Hampsten, was another early American. And then that led the way for Le Mans and then eventually Lance Armstrong. Yeah. Yep.
And you got to remember, Jacques Boyer, he actually led the African, he actually supported some African teams and brought some Africans over from Rwanda. Yeah. That wound up being pro and such. Yeah.
And we finally had an African win a stage of the Tour this year, and he ended up winning 2 and 3 stages.
Yeah, 2 or 3 and the green jersey, right?
Yeah. This guy just came out there and was like, wait a minute. We have a brand new sprinter on the scene. And that guy was awesome. Yeah. I don't even keep up with the Tour that much, but I guess I watched dozens, maybe a half dozen stages.
Right. No, I've worked with Romain Bardet. I've worked with, a lot of those guys. And, it's, when I was at AG2R and such, and it's, as you know, they just have different, they're just different species, different animals.
If you don't mind me asking, how old are you? What's your age?
55.
Do you know Chris Robinson's Wheelworks? He's up there somewhere. He's got a bike shop. He's building wheels and selling bikes and everything else.
Yeah, I've heard of him. Yeah.
He was around all of that. He was around the pro circuit for a while, so I figured, you guys probably know each other.
Oh, yeah.
But, Johnathan, I don't want to keep you you got to promise to come back. This has been...
we could keep going because, I'm still, I got plenty of stories on how I use the ketogenic diet and bike racing. I'd use it, I think, the metabolic advantages, and then, we could go on, like sports injuries for this, for my percutaneous hydrotomy.
Can I have you back pretty quickly? Literally, I have to go to California this week to take care of something, but I'll be back next week. Can I bring you back on for a part 2?
You just let me know, and I'm more than happy to come back.
As soon as we cut the mics off, we're going to set up a part 2 here because I would love to get into the ketogenic diet and going long distance because it's one of the things people ask me about. It's like, I can't keep up in the whole thing. And I mean, my friend Tim Noakes just proved that you could get someone deep into zone 3 and still not use sugar, right?
Some people are better than others. I just helped an ex-motocross guy named Jean-Michel Bale, who won several championships, and he did the race across France
Oh, wow.
We coached him, and he did the whole thing pure ketogenic. Yeah,
Is that the Dakar? You mean on a motorcycle or running?
No. He did the race across France on a bicycle.
On a bicycle?
Yep.
Okay, because you said motocross, so I was wondering if he did the Dakar.
He's a former motocross racer.
Okay.
So he was world champion, all this, and now he's our age, my age, and his thing now is long distance, kind of like doing the Ram, and they have a French race called the Race Across France, and I mean, doing it in a ketogenic state was ideal.
All right, so Johnathan, we have a part 2 coming up.
Yes, we do. Okay.
So hang on, don't go anywhere.
Okay.
Let me say goodbye. By the way, Johnathan, hold your books up and tell people they're on Amazon. I haven't read them, folks, but they will be in the Vinny Book Club. It's the revolutionary ketamine, and also Stopping Pain.
And then I wrote this book on marathon with Dr. Veronique Balat.
We got a lot more to talk. We got so much more to talk about. All of that is on Amazon. I will have Debbie put them in the book club, and you guys will be able to find them. But we will do a part 2. Just to let you know, Johnathan, I usually cut these things at about an hour and 5 minutes, and we're at an hour and 15 minutes here. And if I didn't have another podcast, I would do it right now and then just split it into 2 shows. But I have to go do another show. You know what to do with me. We have the new movie out, Dirty Keto. So go check that out. You can go to VinnyTartaris.com, click through the banner. When you watch Dirty Keto, and please rent it, buy it, do whatever you're going to do, but once you watch it, please rate it and review it. That's how people find the movies and go on from there. So go do all of that. I didn't have any music for Johnathan on the front end, but there is this song that Johnathan reminded me of, and it reminds me of my childhood because my dad's band used to play this song. And it's also by Johnathan Edwards. So on behalf of my Johnathan Edwards, put life into living and do it with this Johnathan Edwards.
Sunshine, go away today. I don't feel much like dancing. Some man's gone, he's tried to run my life. He don't know what he's asking. When he tells me I better get in line, I can't hear what he's saying. When I grow up, I'm gonna make it mine. These ain't dues I've been.
Thank you for listening to Fitness Confidential. Get more information at VinnyTortorich.com. Remember to rate and review us on iTunes and follow Vinny on Instagram and Twitter.